So can you see the screen now?
I can.
Okay. So we're going to start on the page 92. Summary. The method of maintaining record depends on the needs of the physician and patients at a medical facility. So with any method, medical records need to be maintained and filed in a manner so that is organized to allow updating records in a timely fashion. The patient information is obtained to assist in the treatment of patient and to assist in proper billing of services rendered. Any demographic information acquired should be done with respect to the patient privacy. The method for scheduling patients differ for inpatient and outpatient procedures. With any type of appointment scheduling, it is important to keep in mind the physician and patient's timeframes. HIPAA allows for patient information relevant to the procedure performed to be sent to insurance companies to receive payment. So with the patient's signed consent, more in-depth medical information may be sent to insurance companies. Patients' refusal to treatment may be religious, family-based, or due to personal preferences. In every situation, remember to respect the patient's concerns while attempting to help him or understand and accept the treatment. However, it is important patient's decision to accept or refuse treatment. At the beginning and end of the day, it is important to adhere to the set procedure to ensure the security of the facility and its contents. When assisting the physician with his or her schedules, know the information necessary to make appointments, confirm appointments that are made, and record the information. Now, employee records should be audited and maintained to ensure that certificates are held for physicians and the medical assistants and are up to date. When an inventory of the supply is maintained, the medical facility will not run out of supplies and use expired supplies. When using coding system for diagnosis and procedures and services rendered, it is essential to confirm that the correct information is used and recorded to ensure payment for medical services rendered to the patient. So now we have some great questions.
Yes, we do. Let's go.
Okay, which of the following would be chartered in the objective section when using SOAP method?
What's SOAP? I forgot SOAP. I think
It is a method. SOAP is for subjective, objective assessment and plan.
so. This would be in the
So he's asking objective section.
a patient's blood pressure, a patient's chief complaint, a patient's therapy. Let me look at SOAP. I forgot SOAP already.
Okay.
Objective. So the objective of the patient coming to the office would be to check their blood pressure, get a chief complaint, right?
Now,
But I would say, gee, a patient,
blood pressure will be the objective,
blood pressure is objective.
right?
Let's circle that.
So using the wave scheduling method, which of the following would be the priority patient to be seen? See now the triage question.
A priority patient not to be seen.
Now, which of the following would be the priority patient to be seen?
Ah, got you, got you.
Who will go first?
The patient who comes first.
It's a wave scheduling, okay? Which of the following will be? The patient who arrives first. That's it.
That's what I said.
Yes.
A.
Yeah, A.
Because it's first come, first serve.
Right. Patient's blood panel results have been sent to the medical facility. If the medical record is organized by section, how should the new result be placed?
Above the previous blood test results.
Right. What information is required for a pediatric patient that is not required for an adult?
The name of the patient's parent.
Right.
D.
D. A 22-year-old cancer patient has refused chemotherapy. Which of the following is the appropriate statement by the
Oh my goodness, my clothes are hot. Okay, a 22-year-old cancer patient has refused chemotherapy. Which of the following is an appropriate statement by the medical assistant? Will you explain to me what concerns you have about this? What concerns you? Will you explain to me what concerns you have about this treatment? B.
That's right. Who must discuss the informed consent with the patient prior to the patient signing? Informed consent. Who discussed that?
Okay, I don't understand the question. Hold on, let me look at this
You know
question.
what is informed consent?
The physician.
That's right. What is the initial information required prior to scheduling an inpatient procedure for a patient?
The physician's order.
Yes. A visiting physician enters a medical facility to meet with the physician attending a patient. So what is the proper action?
A visiting physician enters a medical facility to meet with the physician attending a patient. What is the appropriate action?
Yeah.
Oh, that's a good question. Let's see. Inform the attending physician that there's a visiting physician. I would say B.
Right. That's true.
You never make the doctors wait.
Right. Which of the following statement would be appropriate when scheduling an outpatient procedure for a patient?
Which of the following statements would be appropriate? Did you, it's between B and C. Let's see.
Mm-hmm.
I would say B.
C.
Yeah, I thought I should have said C. Will you repeat the date of the procedure? So both are important, but you don't want them to no-show for surgery.
Right. The next is in which of the following situations would a patient be allowed to refuse treatment?
In which of the following situations would a patient be allowed to refuse treatment? A 17-year-old cancer patient, or an 11-year-old domestic abuse patient?
Tricky question.
You mean pick an answer?
D.
Yeah.
13-year-old patient who have miscarried.
Yeah, that's a very good trick question.
Yeah.
Very good. So you have to read these questions
Yep.
and make sure you select the best answer.
Right. Yeah.
I got mixed up, but it's always the patient who has sex that emancipates them to be legal,
Uh-huh. Yeah. Yeah.
which is crazy to me. But
And,
they have the right, you know.
yeah.
Now let me see. We are on chapter what, 3?
Three. Yeah.
Chapter 4. We're on chapter 4.
Okay.
Did you call Mariah?
No, I didn't call her.
Oh my God, I don't know if she's gonna make it.
Yeah.
We've already.
I'm gonna give her the video link.
I don't see it yet. You have to select chapter 4.
Let's see. Chapter 4 is medical law and ethics. So, introduction: patients have rights regarding medical treatment. They are to be respected by medical system. Every effort should be made to ensure that the patients are aware of their rights and responsibilities. OSHA, the Joint Commission, and the Clinical Laboratory Improvement Amendments have developed guidelines to decrease the risk of injury at a medical facility and for medical professionals. So, chain of custody refers to the special method used to transport and process specimens that may be used in court or legal setting. So it is important to report any illegal or unsafe practices to proper authorities to increase the medical facilities' efficiency and safety. So training on proper response during an emergency can make a difference in the outcome of an emergency. So address patient concerns according to the patient's Bill of Rights. Now, it is necessary to assist patient in understanding the rights that they have according to the patient's Bill of Rights. The patient's Bill of Rights ensure that the healthcare system is fair and meet a patient's needs. It also ensures that the patient have a method by which they can address any problems they encounter. The patient should be aware that they have the right to information that is accurate and easy to understand regarding any medical treatments that they will undergo. They also have the right to information about medical professionals and the medical facility in which they are being treated. Now, if a patient does not understand something, every effort should be made to help the patient understand the information provided in order to make informed choices in medical care. So provide time for questions and have the patient repeat the information back to ensure patient comprehension of the information. Patients have the right to decide between healthcare providers and to choose the one they feel is the best to provide high quality medical care to meet patient needs. A patient has the right to be screened and receive treatment when he experiences extreme pain, injury, or sudden illness that makes the patient fear that his or her health is in danger. Emergency services should be available to patients when and where they feel it is necessary without a wait for authorization or financial payment. A patient has the right to know his or her options regarding treatment. The patient should be informed of the risks and benefits of treatment and alternatives to the treatment being ordered. The patient has the right to know if the treatment is experimental or part of a research study and has the right to reject treatment on these grounds. Patients have a right to know what to expect after treatment and reasonable amount of time for recovery expected after the treatment. Now, after the age of 18 and in certain other circumstances, the patient has the right to reject treatment even if the treatment will save or extend the patient's life. If the patient is unable to make a decision autonomously, parents, guardians, family members, or a chosen representative can speak for the patient. The patient has the right to respectful and considered care from all medical professionals, including physicians, medical assistants, nurses, and nursing aides. A patient should not be discriminated against due to race, gender, nationality, age, or religious preferences. A patient has a right to discuss his or her treatment privately with medical professionals. This discussion of the patient's treatment also should allow time for any patient questions or concerns to be addressed. A patient has a right for his or her medical information to be kept private. The patient is allowed to read and copy his or her own medical records and has the right to ask corrections to be made if the medical record is not complete, correct, or relevant. Now, when a patient has a complaint, he has a right for a quick and fair review of any issue regarding the medical care. Physicians, medical professionals, or medical facility. Now, this includes, but is not limited to wait times, hours of operation of the medical facility, healthcare professionals' actions, and adequacy of the medical facility. Physicians, nurses, medical assistants, and other healthcare professionals are required to identify themselves to patients who are receiving treatment. The patients also have the right to know if the medical professional providing treatment is a student, a resident, or other trainee. Now, if a patient is in pain, he has the right to tell the medical professional, who then must address this issue. Every effort should be made to alleviate the patient's pain, if doing so will not cause potential damage to the patient's health. Maintain safety in the workplace according to regulatory standards. An employee has the right and a responsibility to ensure safety in the workplace. And there are several OSHA measures that contribute to employee safety in the workplace that can be implemented in most every medical facility. Alarms, panic buttons, handheld alarms, and other security devices should be maintained to be accessed if a medical professional is at risk of physical harm. Curved mirrors placed at hallway intersections can provide increased visibility in concealed areas. Patients' waiting rooms should be designed to minimize stress. Examination rooms and the other patient rooms should have two exits. Doors to the staff counseling rooms should be locked to protect privacy and limit access to the room. Furniture should be arranged to prevent trapping of a medical assistant in interview or crisis treatment centers. There should be a minimal amount of furniture or items that can be used as a group, such as the vases, pictures, and sculptures. The furniture should be lightweight without sharp corners. Secure the restroom facilities that lock and are away from the patient and visitor area should be available. All unused doors should be locked in accordance with the local fire codes. Lighting should be bright and effective within and outside the facility. A sign-in procedure should be in place for the patients and visitors, and limit and control access to facilities other than examination and waiting rooms, especially areas that store medical equipment or control substances. Then come the OSHA. OSHA provides guidelines for environmental protection in an attempt to reduce risk to medical professionals working in a medical facility. Medical professionals should wear identification tags to easily verify employment at the facility. Avoid wearing long chains, earrings, and necklaces to prevent being strangled or having neck or head movement constricted. Care should be exercised in elevators, stairways, and any area that is not frequented by staff. Now, OSHA has established proper hand hygiene and cough etiquette to limit and prevent transmission of airborne illness. Proper hand washing consists of at least 30 seconds of washing hands with warm water and soap. The hands should be rinsed with water and soap, rubbed together during washing, and dried completely. Hands should be washed after blowing the nose, coughing, sneezing, or coming in contact with any contaminated source. Hands also are to be washed before and after treating each patient. So it is also important to wash hands after contact with any body fluids and before and after removing personal protective equipment, known as PPE. Use soap and water or alcohol-based hand rub. So when using at least 60% alcohol-based rub, apply about the size of a quarter. Question, that's the question. So apply about the size of a quarter of the rub to the palm of the hand, cover the entire surface of both hands with the solution and rub hands together until dry. The alcohol rub is not to be used in cases where your hands are visibly soiled. Cover coughs, sneezes with a disposable tissue or cloth and sneeze into the upper sleeve. Dispose of tissues promptly in the proper waste containers. The other guidelines include observation of biohazard labels on containers and equipments. Any break in the skin should be bandaged before donning gloves. Smoking, drinking, eating, and applying contacts or makeup is prohibited in the area where the person is likely to encounter body fluids. Food and drinks may not be kept in refrigerator or freezer. Personal protective equipment should be worn when contact with blood or body fluids is anticipated. PPE includes gloves, which you should use anytime you handle blood or body fluids, gowns, eye protection, and masks.
Now, back when I started, TJ, we were dipping the urine, no gloves. You know, back in the 90s, we didn't wear gloves like that. We would dip the pee, wash the hands, and keep going.
Right, right. But time has changed now.
Yeah, yeah.
It's for our own protection,
Mm-hmm.
not for anybody else.
Mm-hmm.
So whatever is needed, this is our own safety. So it has to be.
And my nurses, there was one nurse, I'm going to tell you, I always told her, you have to wear 2 gloves when drawing blood.
Right.
She refused.
Okay.
Because she said she couldn't feel the vein through the gloves.
Okay.
So what I suggest is just tear that one finger out of the glove and you keep the glove on, because one time she drew blood, and you know how the blood keeps bleeding, and she took her finger and put it over the direct blood with no glove. And I keep telling her this is against OSHA, but she kept doing it. Finally, I said, forget it. It's your own protection. You do it. You get hepatitis C, it's on you, because you don't know if you got a cut or a little opening on your finger or something.
Right, right. Never know. Yeah, that's true. It's our own safety. Now we should think this way, It is our safety, nobody else's.
Mm-hmm.
It is for both, but think that you are also going to be affected by this.
Yeah.
Which you should wear. The masks that should be worn as the circumstances dictate, such as when there is a potential for splashing or to reduce the potential contamination. Safety devices should be used to cover needles and sharp instruments immediately after use on a patient to help prevent skin punctures and cuts that could cause exposure to infectious diseases. Now, these safety devices, if they are automatic, that's fine. If not, then we will have to put them. Just dispose all the sharp containers directly into the sharp container. All the sharp instruments or needles, they should be thrown into the sharp container. So needles and sharp instruments also should be disposed of without being recapped into the container that is a leak-proof and puncture-proof container and has a biohazard symbol. Now, this container is known as sharp containers, so that could be questioned. Specimens must be placed in a leak-proof container that prevent leaks during transportation. The hepatitis B vaccine should be offered to medical professionals within 10 days of initial assignment to the job. And that includes contact with blood or the body fluid. The OSHA blood-borne pathogen standard was developed to help protect or limit healthcare professionals' exposure to microorganisms that can cause disease in humans. And this standard covers any employee that may be exposed to serious life-threatening infections, including but not limited to hepatitis B, hepatitis C, and HIV.
Now, I have to tell you, TJ,
Mhm.
where I worked, they did not offer hepatitis B, which is illegal according to OSHA standards.
Right?
Now, years ago, you could go without offering it and you can make them go to their own family doctor and get the shot. But
Right.
because OSHA is saying right here, is telling you have to give them
Mhm.
opportunity to take hepatitis B. You
Right.
cannot withhold this from them. And where I worked, they always told us, go back to the doctor and get it. Your insurance pays for hepatitis. We don't pay for that. They
Oh.
can't do that.
Yeah, actually, no, they should not be doing that. But maybe, I don't know. I have no comment on that. If the insurance covers, then it's okay, get it through the insurance.
They say, it costs money to run the practice. They provide you insurance, you go get it elsewhere, and we don't have to pay. But you get one person that knows the law that calls OSHA. There's fines. So you might as well offer it and have them sign the waiver if they don't want it.
Exactly, that's the procedure. If somebody refuses to get the hepatitis B vaccination, then he has to sign the waiver because this is law. Technically, they cannot refuse it, but then I don't know why they are doing it. So measure must be taken to limit and prevent employee exposure to include having an exposure control plan that must be updated and reviewed by staff. Because if anything happens, you have to have a plan. And this plan lists occupations that may be exposed to blood, along with the list of tasks that may cause this exposure. And all healthcare professionals should observe standard precautions when dealing with patients. And these precautions, they require the treatment of all human blood and body fluid as if they are infectious. So just treat it like that. Then you will be safe. Now, if the healthcare professional has not been vaccinated against HPV, a vaccination will be offered. And if an exposure occurs, the healthcare professional will receive a copy of healthcare provider's written opinion within 15 days of the completion of evaluation. Now, OSHA also provides guidelines for housekeeping controls to reduce the risk of contamination by providing a work area that is sanitary and clean. Decontaminate work surface with a disinfectant immediately after exposure to the body fluids. Now, that's also a question. Now, reusable containers would be disinfected and decontaminated regularly. Sharp containers are to be kept upright and closed to prevent the spill of contaminated sharp instruments. So do not overfill or reach into the sharp container. Use tong or a broom and dustpan to pick up the broken glass. Do not pick up with the hands. Wear gloves to handle soil linens and handle them as little as possible to perform the tasks required. Any material contaminated with bodily fluids should be disposed of in an impermeable red biohazard bag and disposed of according to state and federal regulations. See, in every office, we have sharp containers and this red bag. Anything which is not sharp, but it is contaminated with blood or body fluids, they should be thrown in the biohazard bag. This bag is puncture proof. It doesn't leak. Now, OSHA provides guidelines for instruments and other items used in surgery, examination and treatment. Items such as these must be sanitized before they are disinfected or sterilized. That is also a question. Before sterilization.
Okay, wait a minute. What's the question?
Now, before sterilization of the instruments, what need to be done?
Before sterilization of the instrument, you must clean all human body fluids off of it and soak it in sanitizer.
That is
dry it off.
Yeah, sanitize them. You have to wash them with hot water, first cold water and then hot water. Take everything off the instruments before they are disinfected or sterilized. When performing the sanitation process, the medical assistant should don gloves and latex or utility gloves. If the instrument to be cleaned have pointed edges or are sharp, the sanitation should occur immediately after use. Items must be cleaned in an area that is not shared with the handling of food. Disinfect surfaces to remove pathogenic organisms or surfaces such as countertops or other surfaces that may come in contact with body fluids. The Joint Commission, along with OSHA, recommend that healthcare professionals be immunized against influenza. So medical professionals, they do not receive influenza immunizations or at risk of acquiring the flu and may pass the virus to vulnerable patients. Other methods to prevent the spread of flu virus include the healthcare professionals staying home and don't coming to the work when infected with the flu virus. The frequent hand washing using disposable towels and using proper personal protective equipments.
I don't know what that was.
See, they have to wear the mask and the gloves and try not to spread any germ if they have to come. They're supposed to stay home, not come to work. The Clinical Laboratory and Standard Institute, CLSI. Now, this is another organization that has been developed to help healthcare professionals remain safe. CLSI has written guidelines for laboratories to assist in the development of the safety. The best part waiting is for just in your
Sorry, TJ, my phone hit something and I can't cut it off. Okay. There, I got it. I got the cousin is doing some kind of rap video and I touched on it. It started singing. I got nervous. You can't cut these things off.
Okay, that's fine. The guidelines cover fire prevention, electrical and radiation safety, and other potential laboratory hazards. A CLSI recommend that the long sleeve gowns or laboratory coats with long sleeves be worn in the laboratory. And all PPE worn in the laboratory should only be worn in the laboratory setting, not outside.
Now you see a lot of people wearing it out in the lunchroom and down in the cafeteria. They don't take those coats off.
No, they should.
I didn't know they were supposed to.
Yeah. Because when you go to the lunchroom, you're meeting other peoples, and some might be coming with patients, so they might have some kind of viruses over there.
Yeah,
They
I
can
bet they do.
your weddings,
Mm-hmm.
So that's why those actually those equipments also might have some of the germs, because you are dealing with all the patients.
Ugh,
So they can go to the other people also.
disgusting.
Yeah. So that's why everything should be in the lab. When you go out, you go in your own clothes. You don't spread anything then. Now, among the guidelines established by the Center for Disease Control and Prevention. Now that, remember one thing. This is one of the questions they're going to ask.
Okay, wait, let me highlight it. Where are we at?
We are
Up top? OSHA provide guidelines?
105.
Okay, hold on, let me find this clinical laboratory standards.
Right.
Okay, I'm here. Okay, where's the question?
Second paragraph.
Okay.
Among the guidelines established by Center for Disease Control and Prevention. Question will be what the CDC stands for.
Centers for Disease Control.
See, you made the same mistake.
What?
CDC, Center for Disease Control. No, that's not right.
Oh my goodness, what is right?
Right is Center for Disease Control and Prevention.
They don't put the P in there, CDCP.
Right? No, they don't put P, but still it is Center for Disease Control and Prevention.
Oh my goodness, I have to remember.
Yes. And that would be a question. So they have the standard precautions, originally named universal precautions when developed in 1980. So these standard precautions advise the healthcare practitioners about safe handling of blood and bodily fluids. Now all blood tissue secretions and excretions, with the exception of sweat, they are considered potentially infectious. So standard precautions are designed to reduce the risk of HIV and HPV, which is hepatitis B, HPV. Human immunodeficiency virus and hepatitis B virus, and other blood-borne pathogens in the healthcare setting. The standard precautions refer to blood, body fluids, tissue, non-intact skin, and mucous membranes. The hand must be washed before donning gloves. The gloves should fit the hands well and must be worn when handling specimens.
I just don't understand. These nurses need to put on gloves. Nowadays, you could be drawing blood on a doctor, a lawyer, healthcare professional, OSHA worker. You don't know.
Yes.
Aren't you?
Yes. So the gloves should be worn all the time.
Mm-hmm.
Because there are too many things coming, from the blood. So glove should fit the hands well and must be worn when handling specimens. And do not touch contaminated areas with clean gloves. Because once you put the gloves on, if you touch the contaminated area, you cannot use those gloves for the test again. you have to throw them and put a new one. When handling any surface that is not contaminated, remove or change gloves after touching such items as telephone, uncontaminated laboratory equipment, and doorknobs. Glove must be changed between each patient. So each patient have to use the glove and next patient new gloves. Hands should be washed immediately after removing gloves. When leaving the laboratory and before and after eating, drinking, smoking, applying makeup, using the lavatory facilities, or touching the hair, eyes, nose, or break in the skin. So these are a lot of questions over here. When there is a potential for the splashing of blood or other body fluids, a full face shield or goggles are recommended. Jewelry should be limited to small earrings and short necklaces. Now, fake nails must be avoided due to the chance of contamination under the fingernails. So food and drink must not be consumed in any area where there may be a body fluids. So all these are the safety precautions or the contamination precautions. The follow the chain of custody protocol. The specimens are sometimes required as evidence in the court case. In these circumstances, the healthcare professional must follow certain procedures to ensure the correct handling. Some of the situations in which specimens require a chain of custody include suspected drug or alcohol use, DNA testing for paternity, and the cases of rape. That's where chain of custody is used. Now, when the specimen is for suspected illegal drug use, the test should be performed within a certain period of the time, depending on the reason for the test. Specimen must be labeled with the medical assistant's initial and time the collection was performed. When a person brings in a chain of custody form, everyone who have received the specimen must initial and date the form. For example, if the medical assistant perform the blood draw or collect the urine sample and then present it to the laboratory to be processed, the lab technician must initial and date the form to indicate that she received it. So in case of testing for alcohol use, the chain of custody must be maintained. Any specimen drawn or collected to test for alcohol use must contain the medical assistant's initial and time the collection was made. To prevent false test results, rubbing alcohol must not be used to clean the site of the blood draw. Because if we use alcohol for cleaning the site, we're gonna have a alcohol positive in the blood, even if he's not having any alcohol. So we never use the rubbing alcohol for the cleaning the site in the cases like where we have alcohol test, okay? Any person who has had the specimen in their possession must initial and date the chain of custody form. If a patient has been raped, a sexual assault evidence kit is used. This kit may vary from state to state. Now, once the rape kit has been opened, the chain of custody must be maintained. Now, informed consent must be acquired from the patient before the examination can begin. That could be a question again. We need informed consent from the patients that we are using for the rape or sexual assault cases. The other question, the collection should be made within 72 hours of the attack. So that is another question. Everyone who has had possession of the kit once it has been opened must write his or her initials and time of the chain of custody form. So everyone who have the possession, even for 1 minute, has to sign the chain of custody form. Report illegal or unsafe activities in the healthcare environment. Any medical assistant who provide care and witness abuse or neglect of patients has the responsibility to report these instances. What if we don't do that? Then he will be the accessory. If we don't report it to the proper authorities, then he is with the doctor. So if doctor gets caught, then he will also be the accessory.
Yeah.
Okay. Or anything happens like that, report it. So while each state has different procedures for reporting abuse, when the instance is reported, information such as who, when, and how the abuse occurred must be documented. Depending on the medical facility, the person who files the report to the police may vary. So in cases of suspected domestic or child abuse, the medical assistant should first notify their immediate supervisor of the suspected abuse. If no action is taken regarding this report, the assistant has the legal obligation to inform the police of the suspected abuse. Now, this is another question they could ask you. If you see a the child abuse or domestic abuse, who should you inform first? So that is immediate supervisor.
Wait 1 second. Now, if you see any type of abuse, who do you inform first?
Right.
I'm dialing 911.
No, inform your immediate supervisor first.
Okay.
And if they don't take any action, then you can call the police.
Because these people are crazy. It was I was supervising in a clinic, internal medicine clinic, and we hired this girl, a medical assistant. She hadn't been certified or anything, and I had to terminate her. Right. And when I went to terminate her, we were in the patient exam room, and I went to tell her she was terminated and whatnot. The doctor made me interview her replacement before she left, before we terminated her. Okay. She hit me up in a patient room and told me off, wouldn't let me get out of the room. She blocked the room with her body, and I was stuck in there. You know, that's why I 911.
Yeah, exactly. Then you can do. That's what they are saying. You know, if you tell your supervisor, if they don't take any action, then you are free to call police. Okay? But first you are supposed to tell your supervisor and see if they take any action. So once you have a case like that, the medical assistant should document the instances of abuse and ensure that the information is legibly entered into the patient's medical records. See, everything has to be documented. Otherwise, there is no proof you did anything. So that's the first thing. If a medical assistant witness substance abuse in any other medical professional in the medical facility by any other medical professional, it is her responsibility to report the instance to her immediate supervisor. If any coworker is taking the drugs or any abuse, okay, substance abuse. If the medical facility is a physician's office, the physician should be notified of the instance of abuse. A medical professional should be aware of substance abuse treatment centers in the local community to assist a patient who has questions regarding the treatment. The medical assistants also should be aware of signs that indicate that the patient may be abusing prescription drugs. For example, if a patient might call repeatedly to refill controlled substance prescription, or the review of a medical record states that the patient received controlled substances in the past and is requesting the same prescription again. Then there is a suspicion that he might be using it illegally. Now keep the prescription blanks in a locked or otherwise secured place when bringing patients into the examination room. Actually, the prescription pads should always be kept locked, especially those with the DEA number, the narcotic ones. They should always be locked, kept locked. Do not use prescription pads or notes for giving the patient a telephone number, because he can write down prescription on those, anything. Store a limited amount of controlled substance in a locked cabinet. Ensure that a complete inventory is kept daily on controlled substances. That's another question. How soon we take the inventory on the controlled substance? Daily. And they are maintained in the facility. Immediately report any stolen controlled substance to the police. That's another question. Now, instances of harassment should be reported to the facility manager or supervisor. Before making a report, the medical assistant should become familiar with the facility's policies regarding harassment. And depending on the facility, it may be necessary to report the incident in writing. No matter what the facility's policy is, this kind of incident should always be in writing. If you want them to take an action, it should be in writing. If you don't give in writing, it is up to them whether they want to take an action or not. But if you put it in writing, they have to take an action. Otherwise, it will be unlawful. So keep a copy of any written report they are made, ensuring that the date and the report was made, that is documented. If actions taken are not sufficient to protect the medical assistant from harassment, legal action is required. They have to take an action. If it is in writing, they will take an action. They don't want any discrimination lawsuit. So
Now, why would they get the discrimination lawsuit?
because harassment comes in the discrimination. If somebody is harassing you and you tell them and they don't take any action, that means they are with them. They don't care. Then you can have a lawsuit against them. But you can do that only if you have a written proof. You told it to them and they didn't take any action. So any time if there is a case like this, the medical assistant should report in writing so that they can take the action.
Makes sense.
In case of suspected medical insurance fraud, a medical assistant is required by law to report it according to the facility policy. After a report has been made, the Department of Health will investigate. If the claim of fraud concerns Medicare or Medicaid, or medical assistants are encouraged to report it to the state Medicaid office or the National Fraud Hotline. The report should be made to the program integrity contact in the agency and oversees the state Medicare or Medicaid office. So when contacting the Medicaid office or the hotline, it is important to provide the name of the patient's card number, the name of the physician, and the hospital or other healthcare provider. Report the date that the service was performed and any money that was approved and paid by Medicare and Medicaid. Now recognize and respond to emergency situations. It is important to respond properly to an emergency situation such as fire, electrical shock, hostage situation, bomb threat, or biological hazard. The proper training will help ensure that the correct procedures are performed in an emergency. Be aware of where the fire extinguishers and alarms are located, along with the location of any exits that may be used in case of fire. Now, if a fire does occur, it is important to remain calm, activate the fire alarm, call 911, and then attempt to extinguish a small fire. But be aware that the small fires can grow quickly. Close all windows and doors when leaving the area to help prevent the fire and smoke from spreading. Now, if the smoke is thick, crawl to the exit instead of walking. You know why is that?
So that you don't inhale smoke.
Right, smoke goes upwards. So downwards there is very less smoke. Smoke rises. Assist the patient and other medical professionals to safety if necessary, and do not use elevator in case of fire. And why is that?
The elevator, you could suffocate in there.
No, the elevators are electricals.
And that electricals can go out and you die in there.
Exactly. You could get trapped in there.
I often think about what happened in 9/11. Those people, oh my God, they had to take the stairs, fire below, fire above. It's a mess.
Yeah, it is. Yeah, yeah, but the fire people have those big ladders, hydraulic
Hmm.
ladders. They can spray water from outside. When using a fire extinguisher, ensure that the extinguisher is appropriate for the type of fire. We have so many different type of fires, and we have different fire extinguisher for each fire. So you make sure that you are using the right one. Otherwise, instead of getting the fire down, it's gonna escalate. It's gonna make it more. So class A fires are from ordinary combustible materials.
Oh my God, do I have to remember the class of the fire?
Exactly.
Oh my goodness.
Actually, your place should have the right extinguisher. But then again, it's good to know. Class
Hmm.
A fires are from ordinary combustible materials, which require water-based solution to extinguish. So Class B fires include flammable liquids and vapors that require extinguisher or method of stopping the fire that remove oxygen. Class C fires are electrical fires. They require the method of extinguishes the fire is a non-conductive. And Class K fires is in the kitchen.
And I had one last Saturday. My mom got on the phone talking on the phone for an hour and forgot she had the bacon in the oven and the oven caught on fire. They had to call 911.
Right, right. Yeah. It happens sometimes if you are not aware what you are doing.
Well, she's 79. She's easily distracted. I told her, do one thing at a time. You will not answer the phone. You cook, you cook. You go, you go. Don't answer the phone. That's it. If you got time to sit and chat, then you do that when you're not cooking.
Right, exactly. And bacon goes, very fast.
If she had opened the oven, and guess what? My dad is on oxygen. Those
Uh-oh.
bombs. It was 6 tanks of oxygen, one huge tank, and the oxygen was going. It
Yeah,
was God who blessed them. I'm telling you.
yeah.
This could have been a bomb.
Bomb, yes, exactly. Yeah. So we have so many different kind of fires, so we have the different fire extinguisher for each one. So being aware of the type of fire will help to extinguish the fire correctly. So using the wrong extinguisher or method of fire extinction may cause the fire to get worse.
We don't want that. So I just call 911 and get out.
No, that's true. Yeah, that's true. And they always say that if possible, only then you try to extinguish it. If not possible, go out. You don't want to get, you know, die in the fire.
She and my dad stayed in the house, and they were smart enough to know not to open the oven up and to close the oxygen off.
Right, right.
So thank God. That's all I can say. We had a big, exciting weekend last weekend.
Hey, it's okay if everything is fine.
Yeah, everything is fine.
That's good. So in a hostage situation, the medical assistant should remain calm, contact security or call 911 in medical facilities that do not have a security force. So once 911 has been called, keep the telephone lines clear, and the authorities will state what should be done and what cannot be done. Stand by to receive further information and document all activities. Avoid passing rumors about the situation. Assist patients by helping them keep calm. Many hospitals keep formal bomb threat response forms by the telephone. If a caller indicates there is a bomb in the building or facility, it is important to remain calm and signal a coworker who can notify authorities, while you try to document as much information from the caller as possible. Information that help law enforcement protect the people and property at risk include the date, the time of the call, how long the call lasted, the exact wording of the threat, any details about the caller, such as male or female, speech pattern, accent, or other helpful details, such as pitch, okay, and how old the caller sounds, such as a kid or an adult. If the caller stays on the phone, other helpful questions you may ask include when the bomb will explode, what kind of bomb is it, where it is located. He's not going to tell you, but still, it's okay to ask. And what it looks like. It is also important to document if there are any background noises, such as a traffic or a church bell, as well as the caller's state of mind, such as angry, calm, hysterical, or joking. So never investigate a bomb threat on your own. Always leave this task to law enforcement and bomb experts and focus on protecting the facility's patients and staff. Now, if an exposure to biohazard material occurs, wash or flush the area as soon as possible. If the biohazard exposure is a splash into the eyes, use an eye wash station to flush the biohazard material from the eyes, and then report the incident to the supervisor. Now, after the report has been made, there should be a confidential medical evaluation. So an incident report must be filed that explains any details concerning the exposure. And the medical professional will be tested for HPV or HIV. And the source individual, if known, will consent also be screened for HPV and HIV. Summary. When patients are being treated in a medical facility, it is essential to be aware that there are rights they are entitled to, including the right to know what treatment are ordered and to be performed. Patients also have a right to know the risk, benefit, and alternates to treatment that has been ordered. The patient has the right to information about his health care and to be listened to if he has pain or complaints.
So oftentimes, people tend to, like if you have a patient who's difficult, they label the patient. The patient is very difficult to please. I tell you, I lost my job of 10 years because of this doctor. She had called in and she asked for medical records. I followed policy and procedure to a T.
Okay.
She moved. She was a dentist. And she didn't provide me with the address that she wanted the records to be gone to. So I sent the records to the previous address, the only address I had on file.
Okay.
And I called to see if she got the records. She called the doctor and said, I refused to send the records, this, that, and the other. It was a mess. And I think she was friends with the physician, and that when you get so much money, they don't want to keep you.
Yeah, yeah.
When you're making so much money, I think it's cheaper for them to let you go.
Yeah, yeah.
Now, I wanted to tell you, let's stop after this. We'll go over the questions. We won't proceed to chapter 5. We need to find out if Mariah is going to come for chapter 5 because she's missing a lot of information here.
Right, I will send her these lectures and I will ask her.
So let's finish up here training.
Okay. Now the training and the following guidelines established by organizations such as OSHA, the Joint Commission, CDC, CLIA help to reduce accidents in the medical facility. The chain
You
of
have to go outside? Oh my God, the dog has to go outside. You have to go outside? Come on, go outside. One moment, TJ.
okay.
Come on, go outside. Come on. Come on. Go do your business. Come. I guess he don't want to go. He wouldn't come. Okay, I'm back.
The chain of custody is a method of handling samples that documents the collection, storage, and transfer of any person. It is the responsibility of medical assistant to report any instances of neglect or abuse of patients to the proper authorities. The medical assistant need to be aware of signs of substance abuse and which authorities to notify if there are instances of substance abuse. It also is important to practice substance abuse prevention. Any instances of medical fraud must be reported to the Medicaid or Medicare at the state level according to the policies of the medical facility. And following document guidelines during an emergency can reduce chaos and confusion. So it is important to remain calm during an emergency and to consider the needs of patients and other medical professionals during a crisis situation. So that's it. Then we have bill questions.
Yes.
So when there is an electrical fire, which of the following is fire extinguisher to proper one?
Well, I don't know. Let me go back and look. Electrical is Class A.
Class C.
No, I look, it's right here. Let me read one more time. Fire, Class C fire is an electrical fire. Yes.
So it's
I will highlight it. I'll highlight that one.
okay, it is the C.
Yes, it is.
If the blood splashes into the eyes of a medical assistant, which of the following steps should be performed first?
Flush the eyes.
Right. During a large fire, which of the following is proper action to take?
Crawl to an exit.
Right. For a patient undergoing surgery, which of the following does the patient have the right to know?
The surgeon's grades in medical. Okay, hold on. How many procedures the surgeon has performed? The surgeon's grades in medical school. The B.
B, yes. A police officer opens rape kit and hands it to the medical assistant who presents it to two physicians performing the examination. So which information should be on the chain of custody form?
The initial time of the police officer, medical assistant, both positions. B. Two positions. So it should be the police, the medical assistant, and both physicians. Everybody who touched it.
Yeah, but initial, okay, open the rape kits.
C.
He has that.
The answer is C.
And the time of the medical assistant, I think it should be C.
I do too. That's what I got, C. Okay, let me go back. A police officer opens the rape case. Let me go back to the rape. Okay, let me see.
Yeah, it's B.
Ah.
Initials the time of the police officer, medical assistant, and both physicians.
So my first answer was right, B.
Right, B.
Okay. Everybody who touches it signs it.
Right.
This is illegal. It's called chain of custody.
Right.
I've done many chain of custodies.
Oh, you did, okay.
But I never did the rape kit. See, I never did the rape kit.
Okay. For a venipuncture to be performed on the patient suspected of drunk driving, which of the following is proper cleaning agent?
A.
Now, remember they told you in the alcohol, see the DUI, if you use alcohol, it's going to be false positive.
All right. What do you use? The hydrogen peroxide?
Benzalkonium, D.
D.
Yeah,
Good to know.
right,
I didn't pay much attention to the drunk driving, and I need to.
right. So which
You know what I found out recently?
uh,
These alcoholics that get out of inpatient treatment center, did
mhm.
you know they buy NyQuil and cough syrups to get drunk?
Yeah, because there is alcohol in those too.
So the one guy that got out of the inpatient treatment center that I work with, he
Mhm.
told me they caught him when they came to the house to test him. He tested positive for alcohol, and he told them all he took was NyQuil. And they told him people drink NyQuil to get drunk, so he got more time in the
Yeah,
rehab because of it.
but you know he don't understand that there is a medicine in that too. Besides
Hmm.
alcohol, there is a medicine. But if we have the overdose of the medicine, that could kill them.
Yes,
So they should understand that also. It's not only alcohol.
I
There's a,
didn't know that.
there's a medicine in there too. And the medicine has a dose. So that means if you overdose it, that can harm you.
Oh my goodness.
Because if the small bottle, the 8 ounce bottle, if you drink the whole thing, that's too much medication for one time.
Mm-hmm.
Yeah. So that could harm the person also. So which of the following should be used to clean the counter that has been exposed to body fluids?
A.
Right. Which of the following is the first action of medical assistant who has observed a healthcare professional abusing controlled substance in the physician office that should take?
It's either A or C.
A.
Inform the physician.
Always tell the whoever is the uh, manager or you know
Yeah.
in the
Owner, manager.
clinic, the doctor is the number one
Yeah.
because everyone works for him. So which of the following statement would prompt a medical assistant to be concerned that the patient is abusing a controlled substance?
All of them, but the B
B. Yeah, oxycodone is a narcotics.
and Valium ain't good either. Neither is Zofran.
No, the others are maybe tranquilizers,
Yeah.
but not the narcotics. Oxycodone, there's a codeine in there, that's narcotic. So B.
Yeah.
What of the following actions should medical assistant take first when patient states that he has been a victim of domestic abuse?
Inform the police.
Now inform the supervisor. Remember?
Oh yeah, the medical office manager.
That's no. This one says inform the police.
Oh, I was right. Inform the police.
Right? Yes.
Okay, hold on. I scratched it out.
If anything, this is domestic abuse. If anything at the facility reported to the supervisor, and if there is outside the facility, inform the police.
So inform D is right.
Yeah.
Okay, let's finish, TJ.